Welcome back. May is Stroke Awareness Month, a time all of us are raising awareness. And this afternoon we have Promedica neurologist Dr. Ehad Afreen with us to talk about some of the newest breakthroughs in stroke treatment. Thanks for being with us. What kind of day do you put in typically at the hospital, a clinic, or where do you go?
So both. Today I was working at the hospital, rounding in the hospital, but usually when I'm not, I'm in clinic almost every day.
You guys really work hard. Tell me, let's separate exactly what is a stroke.
Got it. So stroke is when the brain suffers damage from either compromised blood supply or decrease in blood flow to the brain or rupture of a blood vessel causing compression of the brain, which is called an hemorrhagic stroke. And the first one is called an ischemic stroke. So either compromised blood supply or a ruptured blood vessel causing compression of the brain. That is how it would cause damage, and that's what we call a stroke.
Is an aneurysm a form of stroke, or are they separate entities?
An aneurysm is a potential cause for a hemorrhagic stroke. An aneurysm is an abnormal dilation or swelling of part of the wall of a blood vessel which has been weakened with high blood pressure, high cholesterol, or smoking, and then it enlarges and it becomes an area of weakness. So when that ruptures, it causes blood to come out into the around the brain, and that compresses the brain, and that's how it causes damage. So it would cause a hemorrhagic stroke, hemorrhage in the brain.
When you're looking at a patient, you probably get them after they've had the stroke and dealing with the whole thing, but what are there some tests available now to find out if you're more susceptible to stroke, if you're a high risk of stroke?
So usually there are tests. The first one that we would usually get would be a CT scan of the head, and that can give you suggestion of if patient has had previous strokes, and that would alert you to the possibility that maybe that's what they're having or that's what they've had in the past. But in terms of predicting the risk of stroke, I think that would be, you're referring to the stroke workup, the testing that a patient gets when we're suspecting they've had a stroke or they're having a stroke. That would include CT scan of the head, MRI scan of the head. It would include ultrasound of the heart, some blood tests to check your lipid levels or cholesterol numbers, screening for diabetes. Those would be part of the test that we would do if someone has had a stroke or has been suspected to have a stroke. And that would give us an idea about the risk of recurrence or risk of vascular events affecting the brain.
You're a pretty young guy, but in the time you've been in medicine, what kind of growth have you seen in terms of diagnosing and treatment?
A lot has changed in the last 5 to 10 years, especially, and I've graduated about 10 years ago. For example, nowadays we're using artificial intelligence to, and that's helping us advance the ways or improve on the ways that we detect strokes and even the way that we treat them. For example, we have softwares. For example, if a patient gets a scan, a CT scan of the head or a CT angiogram, other tests, then there's an AI that performs imaging processing, and that makes the images and the results available to us on my phone. So I can see that as even if I'm not around the patient, I can see the patient, see the images, I can see the results from the software, and I can make a decision fairly quickly. That's one example of how the new developments have changed things. And now we're having more indications for treating strokes, because with a stroke, there's always an acute treatment that you can have if you have an ischemic stroke. So we're expanding the indications for those. We're expanding the population in which we can use those treatments, and that is being, I believe that's because we're improving the tools that we have, and AI is the main driving force behind that.
We have about a minute left, but if someone gets a stroke, like some people may get a stroke and not recover. They may be paralyzed right of their body and struggle without speech, things like that. Other people have a minor stroke and can recover. Are we a long way from finding ways to solve the initial damage to the stroke, that the people are going to recover as much as possible?
It's difficult to answer.
Depends
that
on
question.
the time before they get treatment on it.
Yep. So it's difficult to answer that question in a minute, but what I'm going to say is the initial insult does eventually determine how much you're going to recover.
Sure.
If you end up having a big stroke, and there are some certain diseases associated with bigger strokes, But it's a whole process. It's difficult to prognosticate at the very start, but we see with our therapy and rehab, we see that even patients with large strokes improve. So what I would say is, once you've had a stroke, I would wait a few months before we can actually say this is how the patient is going to look like.
Yeah.
Usually patients are depressed a month out of the stroke because it's a different person for them.
Yeah.
They're not the same anymore. But we encourage them to be patient, keep doing therapy, and eventually by 6 months we see a significant improvement.
Doctor, it's exciting to see that AI is being included in the diagnostic. That gives a whole new direction in that. Thank you so much for coming here and talking about something so important.